So as we've mentioned, the laminae, as they begin to separate, result in a structural deformity where the pedal bone and the hoof capsule become separated. The video image we can see illustrates the hoof capsule as it is being pushed upwards away from the pedal bone and is causing a ridging effect at the coronary band. We can see quite a prominent ridge. As the pedal bone sits down further within the capsule due to the separation, we are presented with a bulging sole. The concave nature of the normal hoof has become convex as the pedal bone pushes down. This structural deformity results in the pain that we see in laminitis. As we look dorsally at this hoof, we can highlight the ridging effect as the hoof capsule is pushed up and away from the pedal bone. So, what causes the cells to let go? There are numerous diseases that can result in laminitis. These diseases, such as grain overload, endometritis, which is an infection within the uterus, colitis, which is an infection and upset of the natural horse's gut flora, Cushing's disease and obesity, which cause metabolic syndromes which can affect the horse's laminae, and weight overload, such as a horse that is bearing all its weight on one limb due to an injury in the other. All for different reasons result in the same disease, laminitis. The reason for this is that they have the ability to induce the trigger factors which can separate the laminae and instruct the tight junctions between the cells to let go. Research has told us that there are several inflammatory mediators and bacterial cell signals which, when circulated through to the feet, can instruct the laminae to separate. In this slide we can see on the top left hand corner of our cartoon diagram the healthy, fat looking laminal structures which have nice healthy cells lining the edge. This corresponds to the inset of the image on the right hand side. As the disease develops, the cell junctions become distracted and separate. The cell laminae wither and are separated and distracted from their seat in the laminae. As we can see, this corresponds to a withering and an abnormal histopathological section, as we can see in the larger inset on the right image. Once this separation occurs, the pain and structural defect which the hooves have suffered results in not only laminitis in one foot, but can often be both front feet, and in some very unfortunate horses, as we can see presented here in our video, can occur in all 4 feet. Once the insult or disease which affects the laminae causing laminitis has started, several factors indicate how quickly or how severe the laminitis will become. The most important of these is the weight of the horse, because the separation of the hoof capsule from the pedal bone is a physical phenomenon determined by how tightly the laminae are attached to each other and how the distraction forces associated with the weight of the horse and the movement of the pedal bone cause the separation to occur. The combination of these factors, i.e. the weight of the horse and the number of junctions to separate, will determine the speed of the separation and how the disease progresses. The separation which occurs in the laminae due to the laminitis can have secondary knock-on effects. In this pony we see walking around in a circle, quite reluctantly moving because he's painful in both his front feet due to laminitis. But this pony is also suffering from separation of the pedal bone and rotation of the pedal bone within the hoof capsule. This pony will need some therapeutic trimming of the feet and therapeutic shoes in order to lessen the effects that the laminitis has on the hoof capsule. The second most important effect that the laminitis has on the hoof capsule is on the blood supply. Here we are presented with two radiographs. The left hand side is a normal foot radiograph where the pedal bone is in a normal position within the hoof capsule. The image on the right hand side illustrates that the position of the pedal bone has rotated down and away from the hoof, caused by the separation allowed by the laminitis. This has a secondary knock-on effect not only in the pain level of the horse, but also in the blood supply to the horse. The bulging convex sole and the dislocation of the hoof capsule, which we can see presented in the images in front of us, can severely affect the ability of the blood to circulate around the hoof. The image on the left hand side, which shows the perfect and present microvasculature of the laminae and the blood flow through the larger vessels of the hoof, are not present or have been severely affected, as we can see in the image on the right hand side, due to the laminitis. The blood supply which arrives at the coronary band due to the laminitis can no longer circulate its way around the hoof. This lack of blood supply not only affects the horse's ability to grow new horn, but also to repair the damaged horn caused by the laminitis, and severely impedes the immune system within the distal limb, allowing infections in some instances to occur.